Okay, thanks for showing interest in another episode of Hell. Okay, I want to show you on monitor in the hypertension episodes I'm dealing with. There's 177 or 101. I wanted to show these to the doctors. I went to the emergency room, and I was saying, look at this. 184, 108. I said, hypertension, man, I got this high blood pressure related with my injuries. The medication is controlling the symptoms. Look at this one. Bam. I'm going through hell. I'm going to do another blood pressure monitor in front of you. But these are some of the readings. They vary, but they've been getting very awful. Now I go there today to Dayton, and I've been contacting the Veteran Exploitation advisors and other personnel all week, telling them about the problems and the risks and the danger. And now the symptoms, you can even see my stomach is bloated, and I never get this. And it's a symptom of high blood pressure can cause in your liver and your gut, and the distension and the bloating, the water is held. Ow. Now I go there because I've got injury and trauma still, and it's not getting diagnosed. From my shoulders, my hip, my ribs, my back, including the ribs, my scapula is damaged, my clavicle is just like busted and twisted, and it's gouging. Both the shoulders are dislocated to a great degree. That increases with the audio. Now the thing is, with the hypertension too, I'm feeling tingling in the extremities. There's changes in my skin, and this is pretty quick. I mean, my injuries are really serious, and they've been neglected. They are being neglected, diagnosed. I get gas and flatulence now, insomnia, and my medication has stopped. It stopped like well over a month. They slandered me, and I had to take buprenorphine. Didn't make any arrangements. Just took this onto me. But I'll show you when I go to the emergency room and stuff how they're obfuscating and covering up and indulging in harm and endangering me. I said I have insomnia, fatigue, exhaustion. Of course, I can't sleep. It's just the throbbing pain. My breathing is shallow. Of course, the ribs hurt real bad and inhibit my respiration, breathing and aspiration. I've gotten ill. I sneeze and cough now. Sneeze a lot. It's just interesting. I was paying attention to my stool and urine though. I don't think I'm urinating a lot. So I'm concerned with how the hypertension and the other conditions related with, the pain, the injury response. It's parasympathetic, it's autonomous, it's my body reacting. Now the pain medication, and it was being managed. And then I will show you later what's retaliation and reprisal. And when I'm trying to do a responsible thing alone, but thinking that people in certain authority will help me since they are there for patient advocacy or else. And I've contacted the program and compliance and ethics people, managers. Like I said, I'm concerned about how the hypertension affected my kidneys, my liver. I'm sure it is in the GI. The eyes, I never get headaches, and now it's just right behind my eyes. My eyes are just so, it's just the fuzzy, the pressure is there. It's awful. And I've had an episode of the phobia brightening, literally brightening it's called. And I had the extremely pain sensitivity to light because of the hypertension from neglecting my medication. And this was several years ago, which I already was injured and was being neglected then. So it's complex pain syndrome related with injury and trauma. It's being neglected, diagnosed, believed, treat, remedy. And I'll say, these are the notes. And it's a joke, because it just says what? Chronic pain syndrome. And no vitals. They took no vitals. Right there at Dayton today. It had 168 over 107. And then I took my monitor and I wanted to show them the record. And they actually said I was not going through what's called trauma level hypertension. I'm like, now I look at, and I said, I informed them about all the symptoms. And I lay out information. And she still did not examine me. Gave me this line about, really I get gaslit all the time. Gaslighting. It's awful in the Veterans Administration. As you can see, there's 3 documents. Another one when I was there, and this guy was kind. He provided some medication. Still some issues with his diagnoses and clinical actions. So, but this is the worst. When over early May, when all this could have been averted, when I had to go through the trouble and risk all the way to Chillicothe in southern Ohio. And this is the joke. And this is the one. This whole discharge instructions totally covered up the injury and trauma. Said my pain is related to my age and normal. And that's what I was saying. It's like this person has no credibility. And she didn't do any examinations. These people have not performed any x-rays on me, not offered any medication. Well, one person did. And but today I get this, okay, the person who I saw on the 29th in Dayton, he actually did indicate the injuries and some of the crimes that involved the assault and battery, actually. But I get today, like, oh, we can't give you medication because it's a DEA that will look into it. I'm like, I showed all the policies that I was familiar with on my phone. I was like, you want to talk about policies and references and laws and statutes? I said, the problem is they're not being enforced. They're not being abided by. I'm not protected. I said, I'm not being protected, supported, or represented. That's why this is happening. And I got to get a legal representative, somebody to hammer these people and others that are being indulged. Ow. Oh. And as I was saying, it's like it should not be in this position, but it's reprisal, retaliation, and get out, just give you a peek. Oh. Oh. Like I said, my eyes just, it's like that fuzzy feeling is, and it's bad because it's like it just feels like they're just bulging out of my head because the pressure in the back is so bad. Oh. And I never, as I showed it earlier, and you can see the average is just climbing. My average now is in the red. it's clearly in the red. That's the average now. And there's still some of the record way back of 260. And the early records were 100. I showed 100 over 70. Perfect. Oh, yeah, so you can see I went there dating today. They didn't do anything. I had plenty of time in the afternoon. So they shuttled me to a provider and set me up with a pain management program all right there. Oh, I'm still pretty sore. I'm worried it's going to, it's actually a little lower. Really talking about something. But the thing is, now I'm concerned because it just feels like I'm been a week. And even my heart rate's increased. So weak and shallow is like near shock. You know, weak and shallow. Oh.